Now, today is World Tuberculosis Day, and TB Day is observed annually on March the 24th to raise awareness and efforts to end the global epidemic. This year, the United Nations, in partnership with the World Health Organization, calls for action, urging member states to accelerate the rollout of the new WHO-recommended all-oral treatment regimens for drug-resistant tuberculosis. The theme for this year is Yes, we can end TB. Joining me to discuss this is a public health physician, Dr. Mariam Oshodi. Thank you so much for joining us on TVC News at 1. Talk to us about, the significance of raising awareness on world tuberculosis, the tuberculosis, often called TB.
Okay, thank you very much for having me. Good afternoon. So every March 24th is stated to celebrate the World Tuberculosis Day. And it's important because over 74 million lives have been saved since year 2000, due to from global efforts to end tuberculosis. In year 2021, we had 1.6 million people that died from TB. And people are still falling ill from TB. In 2021, we had over 10.6 million people that also died from TB. And so what's the essence of this is that TB is still very much with us. People are still coming down with tuberculosis. And the essence of the World TB Day is to increase the awareness to the general public and also to leaders and governments in different countries of the world to encourage and inspire to them that we can still end TB. We are still battling with TB for several years. It's something that should have ended for a long time. But it's also to encourage them that, yes, we can end TB. And it's important to also increase awareness to the general public so that they can come out to test more. We have very low number of people testing for TB. People don't get to go to the hospitals to check even if they have TB or other illnesses.
All right. Some people, whenever they cough, they just assume that it's just a normal cough. Even when some people are saying that the way you cough is not really normal, is not ordinary. How can you describe for us the symptoms of one who has a TB? And can you talk to us about the recent advancements or breakthroughs in the research into, tuberculosis treatment?
Okay. So for someone that has TB, first of all, some of them might be asymptomatic because we have what we call latent TB. So people might have tuberculosis, having a guns focus on them, and then they might not even actually show any of the symptoms until they become immunocompromised, and then they can start coming down with some of these symptoms. So one of the commonest symptoms of people having TB is cough of greater than 3 weeks duration. So if you notice you're having cough that is not getting resolved for greater than 3 weeks, you actually need to check if you're having TB. If someone is coughing and the cough is productive of bloody cough, yes, that person could have TB. Some people might not have cough. They might have weight loss of appetite, just feeling unwell. Also, some might have fatigue. Some can come up with chest pain or night sweats. Another symptom is also weight loss. So if you have any of these symptoms that are stated, you need to check if you're having TB. And then these symptoms that I've stated are not they're not fixed to TB alone. You might have other disease entities that look like TB and might mimic some of these symptoms. So if you have any one of them, it's also important for you to check and be sure that yes, you do not have TB.
Right.
Now,
okay. Right. Sorry. Let me allow me to button very quickly. How do you think individuals and communities can, help prevent the spread of tuberculosis, and what role can policy makers, postulate to ensure that this TB is, finally dealt with?
Okay. So for individuals, first of all, you have to look for ways to prevent TB. One of the ways to prevent TB for children is vaccination. Now, children within the first set of immunization, a child receives, part of it is the BCG. BCG prevents against tuberculosis. So we have to encourage our people to ensure that they get vaccinated before the age of 1 with BCG. Now, people also have to avoid living in overcrowded areas, because that's one of the ways that one can contact TB. Someone that has TB can cough into the air, and then the other person can inhale it because it is airborne. Also, it's important that for people that have cough should have good cough hygiene. And cough hygiene is basically when you're coughing, you either cough into a clean tissue paper or you cough into your handkerchief that you keep neatly, or if you don't have any of that, you cough into your elbow. And then, that is also to help reduce the spread of the particles into the air, and then so that someone else does not inhale it. And then also for policymakers, yes, for policymakers, we also have to ensure and increase that the services to prevent TB and treatment are readily available in facilities. So TB, for people that might come down with some of these symptoms, the first place they need to get to is a primary healthcare center. In some states, we have primary healthcare centers that have ways to be able to help detect tuberculosis on time. So it's also to encourage people with the health-seeking behavior.
Absolutely. It's very important for people who are seeing these signs and symptoms to, seek first aid by going to, these primary healthcare centers, as you've said. Public health physician, Dr. Mariam Oshodi, thank you so much for your time. Thank you.
Yeah, thank you.